amazing topic. And I'm saying amazing because this is a topic that I'm very, very passionate about. And this is the topic of osteoarthritis. And so, as we know, osteoarthritis is a combination of an inflammatory condition and degenerative condition, which essentially is its inflammation and destruction of our joints. And I'm saying that I'm passionate about this because when I first started, due to my own health journey, struggling with multiple chronic symptoms, and one of them was joint pain. I had multiple pains and aches of my joints, and I learned through my functional medicine, nutritional medicine journey, how to resolve these issues without pain medication. And so I was really blessed and honored to be able to focus in the first few years of my practice mostly on chronic pain patients. So we would see a lot of patients with joint pain, arthritis, osteoarthritis. And this is where I feel like functional and integrative medicine really shines. And you can really do a lot to help those patients by understanding the root cause, what's driving that inflammation, and also offer natural solutions to reduce pain, to reduce the rate of degeneration, and to bring your patient a better quality of life without the side effects of excess medications, right? So this has been really a blessing, and we wanted to share with you. Of course, this is going to be sort of like a mini discussion and a mini class. But if you've seen patients, if you yourself or family member or somebody that you know, or your patients are coming to see you and they're struggling with degenerative, chronic, painful joint conditions, then this is the mini class for you. Dr. Chill, what was your impression from using the functional medicine and integrative medicine to help patients with those types of chronic joint pain?
This is actually near and dear to my heart as well, not only for myself, just because being extremely active, I'm constantly looking for alternatives to pain medications, or even, what's constantly out there, just from a functional medicine perspective, on how to optimize my joints, how to optimize my muscles, how to optimize my activity. And when I was in med school, I did a lot of rotations in sports medicine clinics and pain management clinics. And that was a huge part of my first clinic when I first started practice. So oftentimes I would get patients coming to see me wanting alternatives to their pain, right? Or their degenerative joint conditions such as osteoarthritis. They didn't want to constantly be on NSAIDs, or some practitioners and some doctors were even prescribing steroids for them, and they didn't want to constantly be on that. So my job during that time was to do a lot of research and regarding other options for these patients. And I'm actually really excited to share some of those options that I found in the beginning of my medical school, all the way to while I was working in the clinic. And then I used it in the clinical formation or in the clinical format, and I saw the firsthand effects of it. So I'm really excited to be sharing all of this information with the students here and these practitioners here.
Yes, absolutely. And it's really where we are right now. It's a really cool place to be, because I'm saying this because when I first started working with those patients, probably about 19, 20 years ago, and I didn't have all the amazing studies that we have today to back up what I'm doing, right? And today, when we teach in our community, if we teach specific method and strategies to treat anything from diabetes type 2 to autoimmune conditions to metabolics, joint pain or neurological conditions, whatever it is, geriatric conditions. We show the study, the clinical trial, and the resources, and we have very specific data. Like we know exactly how much to use, what's the indication for each compound, what's the contraindication, what the result that we should expect. So that's why I'm saying we're in a really cool place, because when I first started, it was about probably 19, as I mentioned, close to 20 years ago. I didn't have all that study, right? There were studies, but there was much less in our field, at least. And when patients would walk into my practice, I'll never forget it. Patients will walk in. I would spend about 45 minutes to an hour with them at the beginning to get to know them better, medical history, physical exam, the whole thing. They would sometimes ask me, if they hear about me from somebody, that was even better. But sometimes they would they would call and say, hey, I've been struggling with knee pain, back pain, got osteoarthritis. My doctor said it's pretty bad. Like, I've tried steroid shots. I've tried different things. Is there anything we can do to help? Right. And I would say, they would ask me, like, is what you're doing with integrative medicine or nutritional or herbal medicine, whatever it is, a functional medicine, does that work? And I used to tell patients, I can't, it's hard for me to tell you what it will do for you, right? I can tell you what it definitely did for me, which is it completely changed my life, right? I went from aches and pains every day, right? Trying to be active. My back is hurting, my knees are hurting, all this inflammation, asthma, all these other symptoms. And I went from that on suffering from a regular base to not feeling any pain and having more energy and feeling better and better every time, right? As time goes by, as I'm getting more improvement. I have not taken any medications for years. And I can also tell you, so I can tell you what it did for me, right? I can tell you from other patients that I've seen that if we are able to get a better understanding of what's driving that inflammation, and I can make some suggestion that would be beneficial in reducing the inflammation without more drugs, right, in a more natural way, then those are two ways that we can probably get you some relief, right? That's at least what we are going to be working on and focusing on, right? But today, when we teach our community members, and we got over 20 amazing experts that are teaching each one in their specialty, but we can show things from a very precise, like, here's the study, here's what they used, here's the result they got, right? So it's much more, there's a lot more confidence today when you practice functional and nutritional medicine. So the two things that we're going to talk about today is the two different ways that we can address osteoarthritis. And that's one, the functional medicine route, which is finding out the root cause of the patients that is in front of you. So instead of starting by asking, what can I do to reduce their inflammation? We'll talk about that. That's the second method or strategy to address their pain. We have specific supplements that can reduce, that can inhibit some inflammatory pathways, right? There's our supplements that can support the natural regeneration process that declines with age. But the first thing we want to do with functional medicine is ask ourselves, how can we figure out what's causing this, what's driving this accelerated degeneration, right? Where is that inflammation coming from? Now, we obviously know that there are risk factors. There are no risk factors for osteoarthritis, right? So advanced age, as we age, unfortunately, our joints show the degenerative changes, right? And we know that sports injuries, and we also know that excess weight. So weight plays a significant role in putting more stress on our joints. So just to give you an idea, that there's a interesting article published by Mayo Clinic that every 10 pounds excess that you have adds 15 to 50 pounds of pressure on your joints, your lower joints of the lower limbs, right? So, and that obviously is increasing significantly if you're doing any types of jumping or running or jogging, whatever it is, right? So our joints are not designed to carry excess weight for a long period of time. It accelerates the joint. And this is one of the reasons why we have a big summit coming up on Saturday. It's a whole day summit just focused on the root cause of weight gain and metabolic dysfunction. So we can also help. It's very important when you see patients with joint pain, we have to address their excess weight or obesity, right? Because that would always contribute to accelerated joint degeneration. And one of the things that we know also is that osteoarthritis it's very common. Unfortunately, worldwide, the statistics showing over 500 million people worldwide. So it's a lot of people. In the US, it's about 33 million adults that are struggling. So if you ever choose to focus just on chronic pain, like I did in the first few years of my practice, you're probably going to see a lot of arthritis, osteoarthritis, and other inflammatory joint conditions. But this is, I would say, arthritis, osteoarthritis are probably among the leading ones that unfortunately also lead to disability, right? So we know that as the population ages, the rates of osteoarthritis is continuously growing. So if you choose to just focus on those conditions, know that you are going to be very, very busy. You can just focus on those two, osteoarthritis and arthritis. You're going to have a very busy practice if you know how to do your marketing properly. So other risk factors are obviously that can lead to osteoarthritis. Obviously, is in different injuries to the joints, like accidents, strains, fractures, pre-existing joint diseases like rheumatoid arthritis or gout, and then metabolic diseases. If the patient has diabetes or other metabolic conditions, it could contribute. Remember that diabetes is, according to some report, has a significant involvement of systemic inflammation. And then we know that genetic also and sociographic factors also play a role with it, right? But we are here because we know that with most chronic conditions, our genes are not our destiny, and we can change the expression of a lot of genes just by understanding the root causes. So we're going to be talking about two major root causes that most doctors don't talk about, and we want you to know about. We want you to share those with your patients and learn about those root causes. There's more than two. In our comprehensive functional medicine training, we're talking about 5 or 6 major root causes that lead to osteoarthritis. But here we're going to talk about 2 in this mini discussion. And I want you to think about what's the clinical application. As Dr. Chill and I are going through this, the 2 major root causes, I want you to think about maybe a patient that you've seen before and they were discussing some of those. Maybe for tomorrow or this week or next week, when you're seeing patients with chronic joint pain, ask them questions about these 2 factors and kind of keep an open mind for, like, what are some of those symptoms, right? So we can help more patients by using the functional medicine system. So here we go. Let's get into the factor number 1, the root cause number 1 for osteoarthritis, right? So Dr. Chill, take us in.
Yeah, absolutely. So when my patients were coming in for pain management, right, and they had osteoarthritis, the first question I always asked myself was, what is a primary driving factor that is causing their pain to be chronic, right? So they would come in, and one of their features was that they were in chronic pain. They would take medications, it would go away for a little bit, it might improve for a little bit, it might decrease the pain from like a 7 to 8 to a 2 to 3 for a little bit of time, and then it would come back. So, what was that driving factor that was causing that pain for them and making it chronic? So, they had to stay on those medications. That's why they were coming into me, right? They wanted to get off of those medications or those NSAIDs or those pain meds. And one of the root causes that I found that was a driving factor to that chronic pain was inflammatory foods, specifically foods with omega 6s. You may have heard that omega 6s are extremely healthy, and they are up to a certain point. What is occurring is that omega 6s are overpowering omega 3s, right? And I'm going to get into this, but omega 6s, if you have excess omega 6, this can actually lead to chronic inflammation, which is the driving factor to that pain that the patients were experiencing. And osteoarthritis is associated with chronic inflammation and chronic low grade inflammation. And it is often accompanying that osteoarthritis or that pain, and it's causing that joint specific inflammation or that joint specific pain. And there's also often systemic inflammation that is involved with that, which is coming from the omega 6s. And there was a really interesting study that was completed, and this was published in the clinical journal of pain in 2018, and it was showing that omega 6s, especially high levels of omega 6s, are associated with that inflammation and nociception, which is the pain receptors, is right. It's the indication of pain. That's what nociception is, with physiological stress. And that was all related to omega 6s. They did a cross-sectional investigation, an experiment on 167 adults ages from 45 to 85. They had knee osteoarthritis, and they assessed for their physical pain, their psychosocial functioning, and then they looked at their clinical pain results. They also took blood samples of their plasma omega 6s, plasma omega 3s, and the ratios, and they compared them. What the results showed was that these adults that had higher omega 6s compared to their omega 3s were associated with having greater amounts of pain, both clinical along with functional limitations, and increased in these omega 6s increased their pain sensitivity and their pain severity. And what we're seeing is that we understand that omega 3s or higher levels of omega 3s are associated with lower levels of inflammation, right? Because it's anti inflammatory. And then omega 6s, when, as we were stating, this can actually be pro inflammatory. And that pro inflammation can actually be good, right? Because we need that for things like producing prostaglandins, right? We need those omega 6s, but it's when it is in excess that it becomes an issue. And there's a great picture that I want to share with you that's going to kind of outline the omega 6s versus the omega 3s. So on the left hand side here, we can see that the omega 6s are made up of linoleic acid, arachidonic acid, right? And these are coming from food sources, as I was saying in the very beginning, inflammatory food sources containing omega 6s. And some of the food sources are going to be things like corn, especially corn oil or other vegetable oils, factory farmed meats. All of those contain high amounts of omega 6s. Over time, that becomes pro-inflammatory by releasing prostaglandins and leukotrienes, and these are all inflammatory cascades from your immune response. And that is what's causing the systemic inflammation and then inflammation in your joints. Versus the omega-3s, which we're seeing on the right-hand side, right? The ALA, the alpha linoleic acid, those are coming from things like flax seeds, or the EPA coming from things like wild salmon or fatty fish. That is going to convert into DHA, and that is going to have anti-inflammatory effects, or it's going to help to resolve inflammation that is already there. It's important to note, as I was stating, that omega-6s are still needed, but it is that excessive amount of omega-6s that is causing the issues, especially with our chronic pain patients. So a healthy ratio with omega-6s versus omega-3s ranges from about 1:1 to 4:1. What's interesting from today's age with our factory farmed meats, our standard American diets, in the Western world now, that ratio has gone up to 20:1, right? Instead of the 1:1 or the 4:1, which is the healthy ratio, we're seeing that people are at a 20:1 omega-6 versus omega-3s. So that is causing a lot of inflammation and a lot of chronic low-grade inflammation, which is exaggerating or exacerbating the pain for our osteoarthritis patients. And we are seeing this because of the consumption of omega-6 things and foods such as seed oils, soybean, corn, safflower oil. What's interesting about those oils, and obviously you probably have worked with or had these types of oils. If you've gone to any fast food place, right, they're going to use these types of oils, which actually turns into trans fat. But what it's showing is those omega-6 to 3 ratios are 60:1 or 77:1. And so if you are consistently incorporating that into your diet, what is happening to your body is that your ratio is turning from what should be a 1:1 to 4:1 ratio of omega-6s to omega-3s to about 20:1 or higher. And what I'm seeing with my chronic pain patients when I tested those ratios were that were extremely elevated in their omega-6s. And when we addressed that, they decreased their pain medications because their pain was decreasing due to the decrease in inflammation. And so just addressing that specific root cause with their foods, with looking at their omega-6 to omega-3 ratios, and then we're going to go into a supplement that you can give them to help with those ratios, to help balance those out, to reduce those inflammatory process for them, thus reducing the pain for them. So this is what we're talking about in functional medicine when we're looking at the contributing factors, the root causes, or the driving factors to their chronic issues. So my patients were extremely excited about this because there was something that was actually working for them without them having to take all of these pain medications.
Yes, thank you for mentioning that, Dr. Chill, because this is one of the most important factors to understand that most practitioners don't talk about. And just to clarify, Dr. Chill already mentioned it, but it's always good to clarify again that omega-6 by itself is not a harmful compound to our body. It's actually beneficial, and there's even supplements that contain both omega-3, 6, and 9 together. And omega-6 is definitely needed in the body for multiple processes. The problem is that we have, with the industrial revolution, the processing of food, we have shifted our diet significantly from what our bodies required, our ideal, let's call it our ideal ratios, right? So we're consuming a lot more omega-6 in comparison to omega-3, right? So it's not that to say that omega-6 is not healthy, but when you, like Dr. Chill mentioned, when a patient now feeds off more omega-6 and the ratio is significantly disrupted, now you're activating more the inflammatory pathways. That's, by the way, why you hear why omega-3 supplementation is great for the heart, for the brain health, it's great for reducing of prevention of cardiovascular conditions. Even the American Medical Association has now been recommending 3 grams of omega-3s as a form of prevention for cardiovascular conditions. So it's not necessarily that omega-3 is good and omega-6 is bad. It's somewhere in the middle. It's more about the ratios, right? And of course, when patients are eating fish 2 or 3 times, or seafoods 2 or 3 times a week, then they're obviously getting a lot more omega-3s. But when you look at the amount of omega-6, right, that we have, omega-6, when you think about it, it's very high in seeds and oils. For example, soybean, corn, safflower oil, canola oil contains twice as much omega-6 than omega-3s. Peanut butter, right? It's an American staple in peanut butter sandwiches, right? Eggs, mayonnaise, and avocado oil. Now, again, not to say that eggs are not healthy and not to say that avocado oil is not healthy, right? It's just that what are the ratios, right? And when you're meeting a patient that eat peanut butter every day and they cook with canola oil, then it tells us something about those ratios, right? And they're eating meat. They're pretty much living off meat and chicken, which are low in omega-3s. Now, the only way to increase omega-3 in animal protein is to buy grass-fed. There's actually a survey that was done, really interesting survey. We're not going to get into it too much, the nutritional medicine aspect, but there is an interesting survey that sampled conventional meat versus meat from cows that were pasture raised, which means that they were eating grass instead of grains, right? And they found that there is about 60% higher amount of omega-3s in the meat of the pasture-raised cows, right? So it's good to know that, because if the patient really just likes to eat meat, then that might be a good recommendation to buy pasture-raised or grass-fed meat, because it has higher omega-3s, right? Now, when you think about canola oil is quite problematic because it is a sneaky and hidden ingredient in multiple products: cookies, crackers, granola bars, different snacks. It's heavily used in the food industry because it has vitamin E that is beneficial. It has some antioxidants that are beneficial. Although when you start cooking with it with very high temperatures, some of it goes rancid. So it's very debatable still if canola oil is a healthy thing or not, but it is very high in omega-6. And it's the second most popular cooking oil in the United States. It's very cheap. So restaurants will typically use canola oil. If you eat outside or your patients eat out, they most likely use canola oil. It's also used to mix into olive oil. So a lot of the olive oils that we're buying here in the United States, unfortunately, are fake. And there was multiple reports about it from the Consumer Report and other olive oil associations that reported that some brands are mixed of canola oil and olive oil. And as long as there's like a certain amount of olive oil in the bottle, they can still call it olive oil and sell it as olive oil, right? We talk a lot more about nutritional medicine in those particular programs, in the functional nutrition program and the advanced functional medicine program. But essentially, just for you to know that we are currently consuming in the US in 2022 close to 3 million metric tons of canola oil domestically, which is more than 3 times that we used to consume 20 years ago, right? So the amount of canola oil from 20 years ago has increased by three, right? By 3 times. So that's something to be aware of. And that's where talking not just supplementation, but ask your patients, what are you eating? Are you diversifying your diet, right? Are you also eating seafood and fish? Are you mixing up your foods to make it diverse, right? So that's all important. And of course, we're going to talk about supplementations very soon. But anything you wanted to add to that, Dr. Chill?
Yeah, I mean, that's the biggest thing, right? Is asking your patients what they're eating. And that's what's great about the functional medicine survey, because it asks them right on that survey, what is your diet? Are you eating a lot of dairy all day? Are you having tap water? You know, like those kinds of things. What kind of oils are you using? Those are the things that you want to ask these types of patients, especially patients that you are suspecting that have a lot of chronic inflammation that is going on, because you want to look at all of their factors that are contributing to their inflammation, so you can help them with avoiding those factors or minimizing those factors to reduce that inflammation for them, and then thus kind of reducing many of their symptoms that they have. We're really kind of investigating all of the factors to inflammation in functional medicine with our patients.
Mm-hmm. Yes, absolutely. Now, you might be listening to this, learning about how to help your patients that are struggling with osteoarthritis, and you might be thinking to yourself, but Dr. Chill, I'm a busy practitioner. I don't have time to ask my patients about their diet. What did you eat for breakfast? What did you eat for lunch? What did you eat for, So one of the things that we have now introducing is a 3-day survey, a 3-day journal that you can give your patients when you see them, or you can just mail it to them through your EMR. And we created a simple, really simple. It literally takes maybe 5 to 6 minutes to fill it up every day for the patient. It's not too demanding. It's really simple and straightforward. It asks them about the vegetables, the foods that are high in omega-6 or omega-3s, and what are they eating. So the idea is that when you see them, ask them to bring that journal with them, right? That journal, all you got to do is look at it for like 2 minutes, and you get an idea of, it's like 1 page, simple. You get an idea instantly about what their diet is looking like. You get a general idea, right? You don't need to dive into it like a dietitian would do. You just need to really understand what those foods do, and are they inflammatory? Are they pro-inflammatory, anti-inflammatory, right? What's the benefit and what's the harm? So we always look for tools to help our community members. That's also why we're coming up with the Functional Weight Loss Summit this Saturday. You're gonna get clinical guides. You're gonna get the evaluations. You're gonna get surveys. You're gonna get all these tools that are really important, right? Really important for you to be successful. So let's dive into root cause number 2. And this is gut health and the relation to osteoarthritis. So gut health is a really interesting topic. Hippocrates, who was considered to be the father of medicine, once said, all diseases begin in the gut. And that was over 2,000 years ago. And so it's interesting that today, with modern science, we got studies that are showing us that changes in our gut could lead or contribute to chronic activation of inflammatory pathways that eventually contribute to osteoarthritis. So this is one of the connections, right? And this is called, we have a whole training. It's like a 3-hour training on the gut joint axis and the enzymes that are involved and the pathways and all that stuff. But for now, we're going to pick one or two of those mechanisms to talk about the gut. And I love using visuals, so I brought this visual for you to share with you. And I'm going to explain what we're seeing here. Essentially, this is from a published study from 2022. As usual, we always try to look at the most updated and current studies whenever possible. And in this picture, we can see how changes in our gut bacteria could lead to dysbiosis, meaning that you might have more harmful or pathogenic bacteria and a lower amount of beneficial bacteria. So that's essentially an imbalance that we can call dysbiosis. There's other names for it, of course, depending on the situation. That could be also SIBO, that could be also fungal. There's multiple factors that are involved, but let's keep it simple for now. And what happens essentially is when you have overgrowth of these imbalance or pathogenic or harmful bacteria, you're most likely going to produce more inflammatory cytokines. That's what you're seeing on the top, right? More inflammatory cytokines and more systemic inflammation over time, which accelerates the destruction of our joints, the inflammation in our joints. So on the top left side, you can see the types of bacteria species that are found to be associated with obesity and osteoarthritis. So on the top, you can see there's lactobacillus, streptococcus. There's 3 examples of species of bacteria that if they increase in our gut, they can contribute to, they're associated with increase of inflammation. Now, as a side note, it's important to mention that this is a very general view, but I want you to understand the concept. But we know that some lactobacillus species are beneficial and are actually sold in the supplement industry as a probiotic supplement. So again, this is very general. It's mostly for you to understand the concept. When we dive into this in our comprehensive training and advanced training, we learn about the specific strains of each one of those bacteria. So when you look at your patient's GI analysis, you can say, oh, now I understand these bacteria. They have overgrowth, a larger amount of this bacteria, and that's associated with osteoarthritis, right? So we have to prioritize taking care of this, right? On the other hand, what you can see here is that if you have a reduction of certain bacteria species, that is also associated with osteoarthritis, right? So you might ask yourself, wait a second, how is that possible? Well, because if it's hard to see in that picture, but one of those bacteria, beneficial bacteria, is bifidobacterium. And we know that bifidobacterium produces short-chain fatty acid. It's part of their metabolites, the bacterial metabolites, when we eat fiber, food that contains fiber. Especially most important for osteoarthritis is the short-chain fatty acid acetate, which was shown to reduce the production of pro-inflammatory cytokine interleukin 6. Now, if your patient has, let's say, more or overgrowth of the harmful or imbalanced bacteria, right, that is associated with excess inflammation. But if they also have lower amount of beneficial bacteria that sometimes goes hand in hand, they would also have less of a production, a lower production of short-chain fatty acid, especially acetate, which is important. There's multiple types of short-chain fatty acid. We got butyrate, we got acetate, we got other ones, but acetate is the most important, is one of the most important ones for reducing those inflammatory cytokines. So in some cases, when we look at those patients' tests results, we might supplement them with specific probiotic that we talk about in the advanced program that is based on research to reduce the inflammatory markers, because we want more production of short-chain fatty acids. We want to inhibit those inflammatory pathways, right? Sometimes when we look at a patient's GI analysis and we see that there is overgrowth of the pathogenic or harmful or imbalanced bacteria, we want to clear this bacteria, right? So we might have a herbal antibiotic protocol for a certain amount of time, right? We have specific studies, human clinical trials that we follow those protocols that were used to be and to show us the safety and effectiveness. But that's essentially two of the mechanisms. There are others, but those are two of the mechanisms. Now, these types, some of these bacteria, on the top, you can see obesity. Some of these bacteria were also found to be associated with obesity, right? So again, that's another connection between osteoarthritis and obesity, right? And that's again why we're doing a one-day live summit on Saturday to learn more about treating obesity. So this is one of the mechanisms that I wanted to talk about, which is the gut bacteria. And as I mentioned, there's multiple mechanisms that we're diving in the advanced program, specifically learning how to read the symptomatology. So when you're talking to a patient, the more you understand the mechanism, the better you can start picking up on the cues and the sign and say, oh, this patient might have overgrowth of harmful bacteria or imbalanced bacteria. And then you already know which lab test to order, right? So once you get the lab testing, it's also important to understand the biomarkers, understand not just looking at the bacteria, but also looking at the byproducts of the bacterial fermentation. And you can see, oh, okay, they got more of this short chain fatty acids, or they got more of these biomarkers. Now I need to supplement. I know exactly what to supplement them, right? So in general, if they have lower amount of the lower amount of the beneficial bacteria, we would supplement with probiotics and add fiber. We always want to add the prebiotic as well, not just probiotic, but also prebiotic. On the other hand, if they have pathogenic, harmful, imbalanced bacteria, right? Those that, those might not be the bad guys, but under certain conditions, they might contribute more to inflammation. Then we might need to do some clearing of those as well. Because if you give probiotic or you give fiber to a patient that has imbalanced or pathogenic bacteria, you might grow those bacteria as well. The patient will come back and might tell you, doc, I took this probiotic and I'm super bloated. I feel discomfort. I'm constipated. So we always want to remember that when we work with patients, that we have to look for those signs of the imbalanced bacteria. The lab testing is not very expensive. You can get lab testing as affordable as $120 all the way to the fancy, really, really advanced metabolic tests that are like $360 or $400. And that tells you everything. Tells you how do you break down carbs, break down protein, fat, secretion of enzymes, inflammatory markers. It tests for multiple factors, right? And we dive into all of those. And then the last factor that I wanted to dive in to mention, at least, we're not going to go, it's a very deep, very big topic, but intestinal permeability. We got probably 4 to 6 hours just training on intestinal permeability and how to treat it, how to look for it. But I wanted to mention that because it's really, really important, because if your patient have a state of leaky gut, let's call it leaky gut to simplify it, essentially what happens is bacteria and bacteria metabolites and proteins like lipopolysaccharides could leak into the bloodstream. And lipopolysaccharides are essentially glycolipids. They are a part of the outer membrane of a gram-negative bacteria. And when your immune system encounters those in our bloodstream, you get a very strong immune reaction, right? Now, why am I mentioning all of this? Because there are some really cool and interesting studies coming out in the last 10 years. One of them was conducted in osteoarthritis patients, and the authors, they took samples and they found a connection between lipopolysaccharides, amount of lipopolysaccharides, low level of lipopolysaccharides in patients' serum and synovial fluid, connection with the activation of macrophage macrophages in those patients' knee joints. And so there was also a connection between lipopolysaccharides levels and the degree of joint space narrowing, osteophyte formation, and increased pain scores. So if you want to read more about this particular association and you want to read more about this study, I placed the citation here in front of you. So you're welcome to read it. The study is called Both Systemic and Local Lipopolysaccharides burden are associated with knee osteoarthritis severity and inflammation. This was published in 2016. So very interesting. Of course, there are a lot more different mechanisms. And once you understand each mechanism and each pathway, how from the gut to the joint, it causes more inflammation in degenerative condition, then you also learn about the specific lab testing and the specific supplement or compound that can help with all of those. So the two major ones, if you just remember two from today, is one, inflammatory food, that what we see a lot is the high consumption of omega-6, right? And the second thing is gut health, gut function, gut microbiome, gut integrity, very, very, very important. So Dr. Chill, what are your thoughts about our discussion so far in terms of...
This is something that isn't often discussed in pain, right? Because it's often just given a medication, right? And so I love this discussion because when you take a look at these underlying factors, you could really help your patients out that they haven't been helped out before because they're experiencing this chronic pain for such a long period of time. And when you look at addressing like the omega-6 factor with the chronic inflammation or the lipopolysaccharides with the intestinal permeability causing more inflammation that is increasing their pain for them, and you address all of those things, their pain starts to go away and you start to get these really loyal patients because you actually start to listen to them without just throwing medications at them. So I'm really excited that we're giving you this information. As I was saying, this isn't often discussed in a chronic pain situation.
Absolutely. So of course we have processes, and we have for our functional medicine community member, we have tools that help you to save you a lot of time. We got the evaluation tool that we train you how to use. And all you got to do is just give it to your patient before they come in. And that already flashes out as a screening tool. It flashes out the symptoms of the particular root causes, right? So the way that we used to use it in my practice, the physician, nurse practitioner, nutritionist, acupuncturist, whoever was in my staff that before they walk into the room where the patient is waiting, they would take a look at the patient's they've surveyed, the functional medicine evaluation form. And within probably about 2 to 3 minutes, they already understand what are the 2 or 3 major top factors that they want to focus on, and ask more questions, maybe order the appropriate labs. And then now we also have the functional medicine clinical guide that really gives you specifically here's the lab testing options, here's the treatment strategies, all of that. So there's now 2 reasons why we're going to go into talking about supplements. One, probably 3 reasons. One, you might have a super busy, you work in a system or a hospital, you have got a super busy practice. You might not have time currently to dive into functional medicine deeper with your patients. You have a 5 minutes appointment, but you're learning functional medicine, so you can do that at some point, right? And we can show you if you're interested in opening your own practice. We've done it ourselves very successfully. Our graduates have done it very successfully. So we'll show you how to do that. But you might want to have tools, natural solutions to help your patients beyond another prescription of pain medication. And that's what exactly we're going to be talking about. 2 types of supplements that could be helpful for addressing osteoarthritis. And second reason is because patients are not looking for it. If you looked at the statistics and surveys, the average out of 10 Americans, adults, 7 out of 10, that's what the latest surveys are showing us from 2019, is that 7 out of 10 adults are taking supplements for their chronic conditions. I believe personally that it's probably more than that after COVID, because a lot of patients are much more self-aware. A lot of patients do not want more medications, or you gave them medication, they came back and said, I've been taking this NSAID and it's causing me GI symptoms, right? So the natural solutions very often comes with very minimal side effects, if any. The risk factor is much lower than prescription of medication. There's no risk of addiction, right? So there's multiple reasons why you would want to have in your tool belt, you would want to have a few options for nutritional or herbal compounds that can be helpful. So Dr. Chill, take us into supplements. Take us into what can they use for their patients.
This is actually the supplement that I gave to all of my chronic pain patients. And we now know, and it's because that most of them, actually all of them, had the omega-6 ratio that was higher than their omega-3s. So what I did was, along with decreasing their omega-6 rich foods and increasing their omega-3 rich foods, I wanted to decrease their inflammation quicker for them and also improve their omega-6 to omega-3 ratios quicker for them. And a way to do that was to give them omega-3s. Now, a professional tip for you is, your patients may tell you they're taking a fish oil, right? When I first started, I trusted my patients. And sometimes they would not get better. And I was like, wait, you're taking fish oil. I don't get it. I would have them take a picture or bring in their fish oil that they were taking. And guess what? It was mostly omega-6s and omega-9s. And so now when my patient says, I'm taking fish oil, I say, snap me a picture of the label to ensure that it's only omega-3s. If it's only omega-3s, then they're good to go. Then what we could do at that point is give them the correct dosage that they want to take. And when you're looking at dosages, you want to look at giving them anywhere between 2 to 4 grams, right? There is a study that was completed, and this was a randomized, double-blind, parallel group, controlled trial on 50 adults ranging from 38 to 85 years old. This was a study. They all had mild knee pain with osteoarthritis, and what the study showed was that when they took 2,000 milligrams a day for a month, their symptoms and their pain decrease. It improved their pain, their stiffness in sleeping and standing positions, along with their range of motion. On there, if you want to read that study, it is called krill oil, which is an omega-3, improves mild knee joint pain, and this is a randomized controlled trial. But what I would typically do is I would typically start my patients on about 2 grams or 2,000 milligrams, those are equal, and then increase their dose to about 4 grams. And this is all dependent upon what I thought their omega-6s were. And can be done through asking them, looking at that 3-page dietary journal that Dr. Cohen was talking about, or testing them, right? And if they showed to be tested with higher omega-6s, then I would increase their dose for them to get that omega-3 ratio down quicker for them. And omega-3s worked like a charm for these patients. They were extremely happy with the omega-3s. And my whole goal with omega-3s was not to keep them on those omega-3s forever. I wanted to do the omega-3s to get their ratios down. And once they maintained it, it might be a maintenance dose for a while, or it might be omega-3s as needed for them instead of taking their NSAIDs as they were before.
Perfect, perfect. So that's one way to take. And in case you are wondering why omega-3, then Dr. Chill have went into the different pathways, omega-3 versus omega-6. And remember that omega-3 inhibits some of the inflammatory pathway, while omega-6 in excess, and when we tilt the ratios, obviously has a pro-inflammatory effect, right? So we're trying to tilt the balance again. So now we have a second supplement that is really important. So there's two things we want to do with osteoarthritis. One is reduce inflammation, which we have multiple protocols and strategies on how to do it. There's actually we now know that with current research, we know certain herbal compounds and nutritional compounds can interfere and inhibit certain inflammatory pathway or inflammatory enzymes. So we can be much more precise when we're recommending supplement, instead of just saying, "Oh, take this supplement and let's hope for the best," right? So we got the studies and we got the better understanding right now. But we also, beyond reducing inflammation, we also want to support the regeneration of the joint, right? So we're obviously not going to reverse back time, but we want to reduce the accelerated joint destruction, and if possible, also helps the body to rebuild a little bit, right? And in case you're asking yourself, can I rebuild a little bit? The question is, in some cases, yes, a little bit. And there are some studies that are showing it. And one of the compounds, nutritional compounds, that are really kind of starring in the world of research for the last few years is glucosamine and chondroitin sulfide. And there's a lot of really, really good research that suggests that those compounds are more effective at helping osteoarthritis when are combined together. You'll see some supplements have one or the other, but combining both is more effective. And it's showing to do two things. One, there are some interesting studies that are showing that it can, when taken for long term, can reduce inflammatory markers such as C-reactive protein. And also it can help through improving the microbiome, gut microbiome, to reduce inflammation. That's the second root cause that we talked about, right? So in case you're wondering, how does glucosamine chondroitin work? Then it also works by modulating the gut microbiome. Now, interestingly, there are some studies that were consuming glucosamine sulfate at 375 milligram with chondroitin sulfite 300 milligrams, and they did that about 3 to 4 times a day for 6 months, right? So that's the general consumption. And just to kind of summarize it, here's the study in which we brought in this particular dosage. This is from a study called Glucosamine as Treatment for Osteoarthritis, and it was published in Frontier in Pharmacology in 2022. And here's two really important clinical considerations. One, glucosamine is beneficial when taken for the long term. So that's what we always tell patients, like, this does not work as an anti-inflammatory supplement within 2 to 3 months or 3 to 4 months. This is going to be taken 6 to 12 months at least, if not for some patients longer than that, to start seeing the benefit, right? The second consideration is they have to take a dose that is high enough. For example, there are a few reports, and I will post one of them here, is that the effective daily dose of glucosamine sulfate is 1,500 milligram. So it should be 1,500 milligram minimum of glucosamine sulfate. And it was reported in 2 studies to be able to significantly reduce joint space narrowing when patients consume it with mild to moderate knee osteoarthritis. The effect, and this is really interesting, when those patients took 1,500 milligrams of glucosamine sulfate, The effect was also translated into 50% reduction in the incidence of osteoarthritis-related surgery of the knees during the 5-year period following the withdrawal from the treatment. So again, patients might not feel the difference right away, but the studies are showing us that it significantly reduces the accelerated rate of degeneration, right? So a product of consideration and is a glucosamine and chondroitin by Thorne. Thorne is a professional grade supplement company. We're not affiliated with any specific supplement company. We do our own research and we try to pick professional grade supplement. And then we've prepared, just in case you're seeing patients with osteoarthritis and they're struggling with a lot of pain. We've seen patients by using this following protocol and addressing the root cause. We've seen patients literally get out of a wheelchair within 6 to 8 months. Starting to walk. We've seen patients with swollen knees and their pain reduced by 80%. And I'm going to share this protocol with you because I want you to use it for your patients. So this is a big bonus that I want to share with you, and that's curcumin. Now, you might be thinking to yourself, Tal, that's not a big surprise. We know about curcumin and the impact on inflammation. But there's a trick to curcumin when it comes to osteoarthritis. There's 2 things that are really, really important. One is the quality. The second thing is the dosage. If the patient does not take sufficient amount of curcumin, it does not work as well. They will still struggle with pain. So how do we know what dosage is effective and safe? There is a particular study, high quality study, double-blind, randomized, placebo-controlled with 367 patients with knee osteoarthritis. And here's the study. The name of the study. You can read it yourself. Really interesting study. And this was published in the Journal of Clinical Intervention Aging in 2014. And what they did is one group received 1,200 milligrams a day of ibuprofen. The other group got 1,500 milligrams of curcumin for 4 weeks. They compared the results, and what they found is that the 1,500 milligrams daily dosage of curcumin extract was as effective in reducing pain as the 1,200 milligrams of ibuprofen without the side effects that was reported in the ibuprofen group, treatment group. So here's another way to help significantly reduce inflammation, to relieve joint pain. And what I tell patients is I educate them about this particular study, and we typically tell them this is what they use, this is the dosage, and this is how long they used it. But know that while they looked at 4 weeks, in most cases we would want to continue this probably to 2 to 3 or maybe 4 weeks even. And you got to monitor them every week. You got to monitor every month. You got to monitor them for improvement, right? And make sure that they're not interacting. They're not taking any prescription medication that might interact with that, right? Of course, we learn more about this in the advanced program. So reach out to us if you're interested in learning more about that. Here's the particular study. If you want to read more about it, it's called The Effective and Safety of Curcumin Domestica Extract Compared with Ibuprofen in Patients with Knee Osteoarthritis. This is a multi-center study and published in 2014. So now you know about the 2 major causes of knee osteoarthritis. Remember, there are probably 3 or 4 more that we dive into. And each one of those, we dive much more in depth in the modules of the advanced functional medicine. And now you have 3 different natural solutions for your patients to help them with knee osteoarthritis. So, Dr. Chill, what are your sort of concluding words to us about this treatment of knee osteoarthritis?
Yeah, now they just have the tools that they can start with right away, right? And instead of just giving them the NSAID, let's just ask your patients a little bit more, get some more information for them. You know, what are they eating? Can we look at their inflammatory processes, right? Are they eating a lot of vegetable oil, such as canola oil? Things along those lines. If they are, we can start giving them things like omega-3s. Or if they're in pain, as you were saying, you can give them a high dose of curcumin. And dosage is really important in all three of those supplements, right? Actually, in all supplements in functional medicine, it comes down to the form and the type of the supplement and then the dosage. So it's really important that you work with the pharmaceutical grade or the professional grade types of supplements. And we kind of get into more of that in the advanced medical program here, the functional medicine program.
Absolutely. And there's typically when patients, another reason why we need to, every healthcare practitioner need to understand fundamentally some of the natural solutions and beyond the root cause, is because our patients are actively going home when they keep struggle, or they're sitting at home, keep suffering from joint pain. And guess who they ask about which supplement they should take when they go to the healthcare practitioner and they don't talk to them about supplements. They're not educated about supplements. They're not talking to them about supplements. Some of healthcare practitioners tell them, oh, stay away from all supplements. But statistically, 7 out of 10 adults are taking supplements. We know that because the supplement industry is massive. It's a multi-billion-dollar industry. So we have to acknowledge that just telling patients, oh, just throwing in just figure it out, or go to see a dietitian, or don't take supplements. Most patients if they keep struggling or they don't like the side effects of the prescription, what they'll typically do, and I found this over 20 years of asking my patients, why have you decided to take this supplement? I get the same answer. It's, in most cases, it would be something like, I went home and I asked Dr. Google what I should take for my arthritis. And Dr. Google told me that I should take this and this. And I asked them, well, what does that do? And in a lot of cases, they'll tell me, well, it did nothing. And the problem with that, with self-prescribing patient, is that one, they probably haven't taken the right supplement, right? So we know that omega-3 works in a certain pathway, by inhibiting certain pathway. Curcumin works by inhibiting certain other pathways. Boswellia, certain pathways, certain enzymes that it blocks. Ginger, other enzymes or other pathways, right? So we know when we really dive deep into nutritional and herbal medicine, there are certain pathways that it blocks. And with one patient, we want to give them this. With other patient, we want to give them that, right? And the second reason is they haven't taken the right dosage, right? Third, they have taken a very poor quality supplement. So we want our patients are professional grade. We don't want them spending or wasting their money on off-the-shelf brands that surveys have shown over and over again that sometimes what's on the label, it does not match what's in the pill, right? Or in the capsule. Not a good thing. So we want professional grade. And then fourth, because we have not addressed the root cause. If they keep struggling or developing complication or getting worse, we have not figured out what's driving that disease process. So that's why functional medicine is really great with doing that. So I really appreciate all of you for being here, from taking the time, learning, developing your skills, bringing new skills to your patients and your community. And I appreciate Dr. Chill for being here.
It's always a pleasure.
For sharing his experience, bringing all of this to us. And of course, our media team and Jacob, who without them, we wouldn't be able to meet up with you remotely like this. So it's been a pleasure. And we hope to see you in the summit, the Functional Weight Loss Summit this Saturday. We're going to kick off early morning. We're going to talk a lot about the different factors in gut health, and we're going to talk about the endocrine system and genetics testing, and we're going to talk about different ways to evaluate the root cause. It's going to be fun. It's going to be very, very practical. And you're also going to get recordings of the summit. You're also going to get the clinical guide, the weight loss with specific probiotics, specific nutraceuticals, protocols for reduction of sugar cravings, for weight loss reduction. So it's really, really great learning about the root causes of metabolic and dysfunction and weight gain. Treat the root and optimize your patient's health. That's what we want. We want healthier patients that feel better and appreciate the work that you do for them. So thank you all for being here. Thanks again, Dr. Chill, and I hope everybody will have a wonderful evening.